going to look at another subject, which, you know, of course, this is a sub topic of that subject, which can also potentially impact marriages as well. But we'll be joined on the set by Dr. Kulsum Zakaria Adam, and she is a public health practitioner as well as a maxillofacial surgeon. We're looking at sexually transmitted infections. Yeah.
The condom usage has come down.
Thank you very much. As the condom usage has come down.
Very important.
Hey, Doc, how are you?
Very well.
It's good to see you. Very well too.
Good to see you.
Yeah. Have we met on this set before?
No.
So this is the first time on this set. Okay.
Always meet
on another set. Yeah, wonderful. Well,
exactly.
let's get into the conversation. You know, the whole sexually transmitted infections conversation. For me, I want to dovetail off the previous conversation that we had within the marriage context. To say that, is that something that you come across often in your practice? Is this something that exists? Because I think people get surprised a little bit and say that, what have you been up to? You know, if they have an infection, it's like, it's just me and you. So where from this? You know, take us into that a bit.
All right, so that's true. It is one of the areas that some couples, let's say, they were together and then one has an infection. It gives you the mind to start probing. We are married. If we are married, we are supposed to be faithful to each other. So who brought the infection? Or where is the infection coming from? And a lot of people, it can actually end up in divorce. For certain people, because it means that you are actually doing other extramarital activities and you are bringing the infection home. Especially when you have those sexually transmitted infections that are viral. We will talk about them. That are viral, like HIV, you know, like other, maybe you having herpes simplex or even HPV infections. All of these are some viral infections that there is not like the other bacterial ones that you can have treatments and then you can cure. But these ones can have debilitating, life-changing situations on these couple. So it's very important that at least, I mean, from the conversation that we have, if you're open about your finances, once you have come into that commitment of marriage, you need to be faithful. And it's very, very important. We often say that we have the ABC. That is, either you abstain or being faithful or the use of the barrier methods, which are the condoms. So very, very important. All right, so we'll start off with knowing just a background of what STIs are. So STIs are basically the infections. So they are a group of infections that are transmitted from one person to the other, usually through sexual intercourse. And now we have various ways of having sexual intercourse, like through the mouth, you know, through the anus, and then the traditional way where we all know. So these are infections that usually are susceptible to the mucosa or the covering of these areas that I have mentioned. So when you look at the mouth, the mucosa around the mouth, and then when you look at the anus, the same thing, and then when you look at either the vagina for the women or you are looking at the penis for the men. So these areas are susceptible to these infections, and when you do have these infections, you are able to pass it on when you do have that contact with the other person. And we'll move on to talk about what are some of the risks, or who are those who are really at risk if assuming everything being equal. So the people who are at risk are basically young people, adolescents, youthful exuberance, and they want to experiment, you know. And then others are the fact that people who are in correctional facilities are also at high risk because of where they are, the confinement and all of that. And the men who have sex with men, they are also at risk of this, of having these STIs. And then just looking at the epidemiology of these sexually transmitted infections. So we say that about over 1 million people are affected with these infections on a daily basis worldwide. Okay, so about over 1 million people worldwide on a daily basis.
So to give us proper perspective, you're saying that today we woke up, by the close of the day today, 1 million more people
exactly
would have been infected.
Exactly. So
and
1 million.
1 million.
Exactly.
By Monday morning, and additional 2 million from today.
Exactly.
My goodness.
So it is actually, yes, it is actually a very important health aspect that needs to be spoken about, so that all the preventive measures are put in place to reduce the occurrences of these. So if you look from this estimation that I have mentioned, so if you look at a year, how many, the incidents or the new cases, you are looking at about 370 exactly of infections, of new infections every time. You get it. And you have more than 30% of pathogens that are responsible for these STIs. And these pathogens come in different forms. So you have the viruses, you have the bacteria, you have the fungus, and then some parasites. So some examples that I can just mention here are, so for the bacteria, you have gonorrhea infections, you have syphilis. If you come to the viral, you have your HIV, you have HPV, you have herpes simplex, you even have hepatitis infections, B and C. Okay, and then when you come to the others, even trichomonas is also one of them that you can mention. Okay, so these are some of the bacteria or the pathogens that are responsible for the for you to get a sexually transmitted infection. Okay, now we can now delve into some of the signs and symptoms. Very important. Signs and symptoms associated with sexually transmitted infections. So it depends. As I mentioned, it affects these areas that I mentioned earlier. So it can be from the oral cavity, it can be penile-vaginal, it can also be the rectum or your anus. So the signs and symptoms are varied. Some of these sexually transmitted infections may not have any signs and symptoms at all. And that is where people would keep infecting others from one side to the other. You end up
because
seeing
they don't know that
you don't know that you have an infection. So you tend to transmit it without you knowing that you have any infection. You get it. Others may be that you may have some discharge from either the penis or discharge from the vagina. And the discharge can come in varied forms. Some of them may present as very whitish discharge. Others may be a yellowish discharge to a greenish discharge, and all of these would help you to tell the particular organism that is actually causing this STI. And then certain times you have ulcerations or you have sores around the genitalia. So sores, some are painful, others are painless. So that can also help you differentiate the type of organism that is actually causing this STI. Would be that you may end up having some burning sensation or pain anytime you want to urinate or on urination. That is also another of the symptom that you may present with. Others may be that it could just be a rash, or you may have some fever, or you can have some growths, especially when you have this HPV, maybe the low risk ones, affecting you. You may end up having some growths that we usually call the warts. So either a small growth from around the vulva or even around the penis and all of that. And then aside these signs and symptoms, sometimes if it affects the oral cavity, you may end up having the sores as well in the oral cavity. Some may end up having the sores too around the anus, and then discharge. And then certain times, people who even have anal sex for a very long time may end up having incompetence of the sphincter or the anus, anal sphincter in that regard. You get it? So these are some of the signs and symptoms that are associated with having, and then so these are just the ones that are localized to that area. So assuming you have a systemic involvement, then it means that imagine if you do have HIV, you'd have all those constitutive symptoms with the weight loss, with you being feverish, with you having swellings in other parts of your bodies, and all of that. So these are basically some of the symptoms that these patients would present with. Sometimes you say that, okay, and then odor. Let's not forget, sometimes some fishy odor, basically very diagnostic of some of these STIs. Sometimes it's pungent, pungent smell, okay, is also another symptom associated with these STIs that we are talking about. So how then, what do we do if we have these STIs or we suspect that there's something really not happening, not happening so well with us? So you need to visit your physician, or you need to visit the nearest hospital so that you have to be investigated. So for you to be investigated, usually you would have to go through your history. So your history would be basically, some of these history concerning the number of sexual partners that you have, the number of engagement that you've had in a week, and all of that. And that would help us get into the matter itself. Then the next thing would be that you would have to have a test done. So from blood test to be able to detect the number of the pathogens that are responsible for this infection. Or sometimes if you do have a discharge, not all of them will give you a discharge. If you do have a discharge, the part of the discharge will be taken for investigation under the lab, so that you'll be able to tell exactly what organism is causing this infection. For the women, you would have to have a high vaginal swab, where a speculum will be passed, and then a swab would be taken of the area, and then it would also be examined. If you have oral manifestation, you can have a swab of the area also done and then examined. If it's the anus, the same thing. So based on these investigations, you'll be able to tell the exact organism that is causing the STI, and you would be treated. And as I mentioned from the introduction, I mentioned that it can either be viral, it can be bacterial, it can be parasitic. Based on that particular organism, you can be giving the right treatment. So if it's viral, you would have to undergo some antivirals. You'll be taking some antivirals. But if it is HIV, then you know that it's a long-term treatment. It can't be cured, but it can be controlled and managed accordingly. And then if it is bacterial, then it means that you have to be taking some antibiotics for a number of days, so that you come back and repeat these tests to be sure that you are free of these infections. And yes, so basically this, and when it comes to some complications.
There was a thing, you said something about those who are typically exposed to these things, and you made mention of people who are confined.
Yes.
I understand that, but you also made mention of men who sleep with other men. Exactly. What's the reason for that one? Okay.
So if it's men sleeping with men, it has to do with the immunity. And then also the fact that it is not right, it is not the traditional way. So if you have the penis going into the anus, so the penis will carry whatever bacteria that is there into the anus, and the anus has a lot of bacteria in there. So you having, and most of the time they tend to have several partners. So if they have several partners, they tend to share the bacteria, and eventually that circle end up having.
What about women to women?
Women to women, the same thing. Because they would have to employ some toys of some sort. So these toys, sometimes they are not kept in hygienic environments, and then eventually you end up having that spread, because there is a particular cohort that use and then eventually you end up having it. And then coupled with the fact that you have reduced immunity as well, so they tend to have these STIs amongst themselves, and certain times, I mean, it's very scary. Yes.
As a public health practitioner, what seems to be the challenge in terms of the low condom usage that we're experiencing now in the country? What is it? What's going on?
Exactly. What I would say is that now a lot of when you turn on your TV, you notice that people are rather trying to sell contraceptives. That okay, you can use this contraceptive, and the emphasis on rather preventing STIs to getting pregnant has actually shifted. So instead of, because if you use the barrier method, you don't only prevent these STIs,
you prevent disease.
You also prevent the possibility of conception or getting pregnant. But because there is something else, which is the use of these contraceptives, and people are rather buying more into the use of the contraceptives, they forget the fact that you can actually stop the pregnancy. But then what happens to your risk of actually developing an STI or even transmitting the STI? So it's a very worrying issue. How that people are much more, some way somehow the attention has shifted to rather preventing pregnancy rather than preventing the whole thing, because they know that okay, when you are pregnant, it will be out there, it's visible, everybody sees it, you get it. But then when it comes to the STIs, because they are hidden, most of the time people don't want to talk about it. But I think that it is a call for all policymakers at this moment that we should actually emphasize the use of the barrier methods, because it does us more good compared to just the use of these contraceptives. Because the barrier method prevents pregnancy if it is done well, and then it also goes a long way to prevent some of these STIs as much as possible.
Doc, how often should sexually active people be getting tested for STIs and STDs?
Okay, so I would say averagely about as soon as you feel that there is something wrong. But then if, as I mentioned, some of them you don't have any symptoms, so it's 3 months at least. Every 3 months you can walk in and then have a test done. And the test, there's a whole panel, you can have it tested, and then the next 3 months, 3 to 6 months, you can have another test.
Now, if you're somebody who abstains, typically, then you don't really have anything to worry about, do you?
Yes. If you are abstaining, you don't have anything to worry about. But remember, we said sexually transmitted infections, about 90% or over is from sexual activity. The other little percentage is from people who share needles. So you can actually get HIV, for instance, from sharing of needles. You can actually be infected from hepatitis infection from sharing needles. And even contact, skin to skin contact, and then sometimes the mucosal tissues, contact in those delicate regions, you will end up having it. So if you are, you're abstaining, at least for 90% and over, you are protected. Unless you have these other methods coming in. And also the other thing I haven't mentioned is the vertical transmission. That is from mother to child. If the mother is infected. That's another way to get some of these infections.
Okay, there's I'm Togbo from Boko Sabon Gari. I have a question about the topic. Please ask doctor whether if you have warts on the genitals. Okay, you say you have HPV.
Yes. If you have what?
Warts.
Warts for
warts on the genitals.
Genital warts.
Okay, so
genital warts.
Oh, okay, warts. Yeah.
Can you say you have HPV?
Yes. We mentioned it. So if you have warts or growths, okay, it's likely that you have an infection with the low risk HPV types. So type 6, type 11. They are the ones that are responsible. So you need to quickly visit the nearest hospital for it to be examined, and then the needed attention given to it.
Is it possible to get an STI? It's another question actually, from using public toilets.
No. No, it's not possible to get. It's not by sitting on the toilet bowl that will expose you to. No. So it's through the contact that I have mentioned. So either it's penile-vaginal, penile-oral, penile-anal.
Okay, so if you do get an infection from a public toilet, then it's something else, not an STI.
Exactly. So it's something else.
Okay.
But even that's, there are a lot of myths associated with it. Even when it comes to candida, people say that, I used a particular toilet, but really, when you look into the literature, really, that doesn't happen.
Okay,
it has
so
to do
where do you get this idea from?
Exactly. So they are all myths. Okay, it has to do with, especially, I mean, candida is not an STI, but then if we should take it as an example, it has to do with you having the candida albicans overgrowing in your at the genital area, and then giving you all the uncomfortable signs and symptoms, like the itchiness. Then you tend to scratch for a very long time. Then you tend to have redness and then pain and all of that. You get it. Sometimes it's even the fact that you are using or you are overindulging in antibiotic use. So then it kills most of your
natural flora.
Exactly. And then now the Candida albicans gets that platform to overgrow, and then you end up with that. So it's multifaceted, and you need to be advised if you have that, so that the needed attention is given as much as possible.
Wow.
Right.
Is it manageable? Is it can it be treated, or even after you treat it, is it possible to get it again?
Yes. So it's possible to get a reinfection if you indulge in all those practices.
Go back to
that's STI1. In all those practices that actually got you the infection. So it's very possible that you can get a reinfection after you have been treated, and you are free of the bacteria, or you are free of that particular parasite. But for the viral types, that it can be managed. So if it is HIV, you need to be on long-term antiretroviral treatment, and that would help you to reduce the viral load and then help you to live a normal life. And if it is the HPV, remember we mentioned HPV, if it is the low-risk ones, you end up with the warts or the growths around either your penis or the genital area, or if it is a vulva for the females. So if it is in such a way that it is interfering with normal function, you can have some of these warts taken out surgically. Okay, and then remember again, even though cervical cancer is not an STI, some of these HPV, the high risk ones, 16, 18, can give you the STI, and then also predispose you to developing cervical cancer.
Okay,
you get it. So all of these, depending on which one it is, can be treated, but the viral ones would have to be managed.
Wow.
Yeah.
Well, I think it's been a riveting conversation. Very, very important discussion that we need to appreciate. How do people reach out to you if they want to,
So I'm sure my number is here. If there are any issues, they can call me, and then we can deal with it. And then also the main message is, please, ABC, abstain. Okay, be faithful to your partner as much as possible, and then use your barrier methods or your condoms to help you prevent some of these STIs. And I think some of the media houses can come back together and then make sure that we are actually advertising some of these condoms. In the past, when you turn on your TV set, you will see these condoms and all. But now it's really gone down, and that is really worrying. Rather, people are indulging and then getting all of these STIs and then preventing pregnancies. But really, the matter still stands. STIs are there, and it is affecting millions of people globally on a daily basis.
All right. Thank you very much.
Thank you.
So Dr. Kalsoum Adams is a public health practitioner as well as a maxillofacial surgeon, and she's been walking us through sexually transmitted infections. All there is to know about that. You can always go to Channel One TV on YouTube and replay for your information and just to keep you reminded of the importance of this.